name is Leonardo, and I am a senior dermatology resident at the University of São Paulo, Brazil. And I spoke about my presentation was the case of the recalcitrant teenager. And I was an adolescent, I had some points that bothered me. For example, during the consultations, my mother was the only person who spoke, and the doctor only talked to her, and she thought she knew if I was satisfied or not, or how I was feeling, and the doctor just agreed with her answers. Also, I felt like a terminal patient because I was she didn't let me go to school sometimes, or go to the beach, or stop playing soccer, and I noticed very early how my AD impacted her, sometimes even more than me. And also, I spent all these years with the world famous phrase, "It will get better when we grow up." And all these things help me nowadays as a doctor to deal with that adolescents AD patients, because I know they all pass through the same things that I have passed, and I try to deal with them in some way that I can manage it with these stuffs, not only with the physical aspect of the AD treatment. Yeah, I believe, of course, that the physical treatment is mandatory with the topical treatment and systemic treatment sometimes, but I believe also that very often the patient and their parents need psychological support. And after I entered the residence program, I had the opportunity to participate in these supportive groups and to know and other families and patients that has also atopic dermatitis. And when I get through this situation, I started to understand that their path traveled, it's kind of the same for all patients with AD. And I think that one real good point that can be used is to get to the patients, to know other patients and families, because they can get related to each other and they can support each other, sometimes even more effective than just a long talk with the doctor. I think that the psychological support with a psychologist is very good, but I think that this contact with other patients, it's even better for the patients with atopic dermatitis.